You know, when we think about mind-reading technology, we often picture something straight out of science fiction. But the truth is, brain-computer interfaces are rapidly moving from the realm of imagination into reality. And you've asked us to unpack this fascinating field.
Yeah, there's a lot of buzz around BCI for sure. And, it can be hard to separate the hype from the facts. So let's break down what BCI is, how far we've come, and where we might be headed.
Perfect. Now, I was surprised to learn that the concept of computers interacting with the human brain isn't exactly new. Where did this all begin?
The roots of BCI go back to the 1970s with DARPA, the Defense Advanced Research Projects Agency in the U.S. They started exploring how computers could tap into the electrical signals produced by our brains, using a technique called electroencephalography, or EEG.
Ah, EEG. Those electrodes we often see in movies attached to someone's scalp. But what kind of signals are we talking about here?
EEG measures the electrical activity produced by neurons firing in the brain. By analyzing these patterns, we can glean insights into different brain states and even intentions.
So even back in the 70s, researchers were trying to listen in on the brain's electrical conversations.
Exactly. And what's fascinating is that in 1974, they achieved a breakthrough research, which was top secret at the time, demonstrated that computers could actually respond to human thought, even if in a limited way.
Wow, 1974. That means we've had some form of mind-machine interaction for over 50 years.
It is remarkable, isn't it? Of course, those early systems were rudimentary compared to what we have today. So if we fast forward to the present, the landscape of BCI technology has become much more diverse and sophisticated.
Okay, let's talk about that. How does a brain-computer interface work in practice? How do we actually bridge that gap between our thoughts and a computer's actions?
At its core, a BCI is a system designed to create a two-way communication channel between the brain and a computer. It's about either sending information to the brain or receiving information from it. And we can achieve this communication in a few different ways. The most common approaches are categorized as invasive, minimally invasive, and non-invasive.
So let's unpack these different approaches. Starting with invasive. I have to admit the one always piques my curiosity, but also sounds a little daunting.
Invasive BCIs, as the name suggests, involve directly implanting devices into the brain. This allows for a very precise reading of brain activity, but it does come with inherent risks.
What sort of risks are we talking about?
Well, like any surgical procedure, there's always a chance of infection or complications. And because we're talking about the brain, the stakes are even higher. The potential for tissue damage is a significant concern.
I can see why that would be a major consideration. So when it comes to invasive BCI, who's leading the charge?
One of the most prominent players in this space is Neuralink, a company founded by Elon Musk. They've developed an incredibly innovative approach using ultra-thin threads implanted by a robot they describe as a sewing machine for the brain.
Okay, hold on. We need to dive into this sewing machine concept a bit more. What are these threads and how do they work?
These threads are incredibly thin, about a tenth the width of a human hair. Each thread is packed with dozens of electrodes, allowing for highly specific recording and stimulation of brain activity.
So they're essentially weaving these electrode-laden threads into the brain's delicate network.
Precisely. It's an incredibly intricate and delicate procedure, but the potential payoff is enormous.
It sounds like it's straight out of science fiction,
Mm-hmm.
but clearly it's not fiction anymore.
No, it's not. In fact, Neuralink made headlines recently because they successfully implanted a device called telepathy into a human patient in January of this year.
Wow, a Neuralink device in a human brain. That's a huge step forward. What does this device actually do?
While the specific capabilities of this first-generation device are still under wraps, the ultimate goal of Neuralink is to create a high-bandwidth interface that allows humans to interact seamlessly with computers and other devices using only their thoughts.
So someday we could be controlling our smartphones, computers, even cars just by thinking.
That's the vision Neuralink is working towards, although we're still in the very early stages of this journey.
This is all incredibly exciting, but I can imagine that not everyone is comfortable with the idea of having electrodes implanted in their brains. What about those who are looking for less invasive options?
You're right. Not everyone is willing or able to undergo invasive procedures. That's where minimally invasive and non-invasive BCI approaches come into play. And we'll talk about those next.
So we were talking about invasive BCIs, but you mentioned less invasive options, right? What are some of the approaches being explored?
Cool. Minimally invasive BCIs aim to strike a balance between signal quality and risk. One approach is to place electrodes on the surface of the brain, but instead of going directly through the brain tissue, they access it through blood vessels.
Accessing the brain through blood vessels. That sounds a lot less intimidating than open brain surgery. How does that actually work?
It involves a procedure similar to inserting a stent, a small expandable tube into a blood vessel. In this case, the stent is equipped with electrodes that can detect and record neural activity from the surface of the brain.
So it's like threading a tiny sensor net through the brain's natural pathways. Are there any companies making headway with this approach?
Definitely Synchron, another company pushing the boundaries of BCI, has developed a device called the Stentrode, which utilizes this minimally invasive technique. They've already started human trials with the Stentrode, focusing on helping patients with paralysis regain some motor control.
That's incredible. So even without directly implanting electrodes into the brain tissue, we could still tap into those signals and potentially restore lost function. What about non-invasive BCIs? What are the possibilities there?
Non-invasive BCIs are the safest option as they rely on technology. We're all familiar with EEG or electroencephalography. Remember, those electrodes placed on the scalp can pick up the electrical signals generated by brain activity.
Right, like we talked about earlier. But I imagine the signals are much fainter when measured from outside the skull. How effective can non-invasive BCI really be?
While the signal quality is indeed lower compared to invasive methods, non-invasive BCIs have still achieved remarkable results. For example, in 2024, a study used a non-invasive BCI for mind-controlled gaming.
Wait, you're telling me people were playing video games using only their thoughts? That sounds like something straight out of a sci-fi movie. How is that even possible?
The BCI system used in that study could decode specific brain activity patterns associated with different gaming actions, like moving left or right, jumping, or shooting. So by simply thinking about those actions, the players could control their characters in the game.
So it's not about reading specific thoughts, but rather recognizing patterns of brain activity that correspond to certain intentions or actions.
Exactly. And the technology is becoming increasingly sophisticated in its ability to detect and interpret those patterns. In fact, researchers at the University of Electrocommunications in Japan have developed something even more impressive, a mind-controlled wheelchair.
A mind-controlled wheelchair. That's incredible. How does it work? Does the user just think go left and the chair turns left?
Yeah. It's more nuanced than that. This particular wheelchair utilizes a specific type of EEG called P300. It's a brainwave pattern that appears when a person detects a rare or unexpected stimulus. So in the case of the wheelchair, the user focuses their attention on a specific command like move forward, which is displayed among other commands on a screen.
So the user focuses on the desired command and the BCI detects that specific brainwave pattern.
Precisely. And once the pattern is detected, the BCI system translates that into the corresponding action, controlling the movement of the wheelchair.
That's amazing. It's giving people who might not be able to use traditional wheelchairs a whole new level of independence. Anyone else we should know about, especially over in China? I mean, are they really investing in this stuff?
Absolutely. China is going all in on BCI research. I mean, they've got some serious institutions working on this technology. For example, the Chinese Academy of Sciences, they've developed a BCI that can control drones, and they're also looking into using it for things like rehabilitation and even education.
Hold on. Controlling drones with your mind. That's
Yeah.
like something out of a movie. So both the US and China are making some big bets on BCIs. Okay, so we've talked about the history, the tech, some of the big players, but I'm really curious about what this stuff can actually do. Like
Ah.
in the real world right now, where are we seeing BCIs being used today, and where do you see this going in the future?
That's a great question. And honestly, the applications are all over the place. We talked a bit about medical uses, but let's dive a little deeper into that.
Okay, so medical applications. We were talking about helping paralyzed folks, regain movement and all. But what other medical conditions could BCIs help with?
Oh man, the possibilities are huge. Think about people with Parkinson's, right? Imagine a BCI that could help manage their tremors. Or for folks with epilepsy, maybe even predicting and preventing seizures.
That's amazing.
Yeah.
So it's not just about restoring function, but like having this internal monitoring system,
Yeah.
letting patients and doctors know when something's up before it even happens.
Exactly. And it goes even further. Researchers are looking into using BCIs for things like chronic pain, depression, even addiction.
Wait, addiction. How could a BCI help with that?
Yeah, it's still early days, but the idea is to use BCIs to target the parts of the brain that deal with cravings and reward, those pathways. By kind of like tweaking the activity in those areas, BCIs could help people break free from addictive behaviors.
That's wild. Sounds like BCIs could completely change how we approach mental health treatment. Okay, so we've got all these incredible medical applications. What about other areas where BCIs could make a difference?
Well, communication is a big one. Imagine a world where people who can't speak can communicate their thoughts directly through a computer.
Yeah, I've seen those videos, people with ALS using BCIs to type messages by just thinking about the letters. It's pretty amazing. Gives people a voice back.
Absolutely. And it's not just about restoring communication, it's about enhancing it for everyone. Imagine sending a text or sharing complex ideas straight from your brain. No more typing or screens.
Whoa, that's next level stuff.
Huh.
So we could basically become telepathic. Okay, what about controlling our environment? Could BCIs let us interact with our homes or devices just by thinking?
That's already happening. Researchers are developing BCIs to control smart home devices, wheelchairs, even prosthetic limbs with incredible accuracy.
I read about this study where people were using BCIs to control robotic arms, picking stuff up, playing games,
Yeah.
like something straight out of Star Wars.
It is. And as the technology gets better, we can expect to see even more seamless integration between our brains and, well, everything around us.
Okay, so from controlling our homes to becoming telepathic, the possibilities are insane. But there's this big question I keep coming back to. Can BCIs actually read our minds? Like, is that even possible?
That's the million-dollar question, right? I mean, the truth is, DCIs are getting really good at decoding brain activity. Scientists can now pinpoint patterns that match specific thoughts, intentions, even emotions.
So maybe we can't download someone's entire stream of consciousness, but we can pick up on certain thoughts and intentions. It's kind of exciting and kind of creepy, if you ask me.
I get it. It definitely brings up a lot of questions about privacy and potential misuse. But for now, let's focus on the positive stuff.
Okay, so we might not have full-blown mind reading yet, but we're getting closer to understanding how the brain stores information. What does that mean for the future of BCIs? Where do you see this tech going in the next few years?
Well, I think we'll see both invasive and non-invasive BCIs keep getting better. Invasive ones will probably get smaller, more powerful, able to connect with even more neurons.
So even more data, more precision, maybe even finer control of devices and a deeper understanding of how the brain works.
Exactly. And on the non-invasive side, we'll see better sensors, smarter algorithms. Those BCIs will become even more accurate, more reliable.
So it's like a two-pronged attack, right? Both invasive and non-invasive BCIs pushing the limits. It sounds like we're about to see a real BCI revolution.
I think we are. BCIs have the potential to change everything. Medicine, communication, how we interact with the world. And as the technology keeps evolving, we'll see even more amazing applications pop up.
This has been incredible. We've covered so much, from the early days of BCIs to the cutting-edge research happening right now. It's clear this tech has the power to totally reshape our world.
Yeah, it really does feel like, we're entering this whole new world where the line between our minds and technology starts to blur. It's exciting, sure, but it also makes you think, what are the long-term implications of all this?
That's the big question, isn't it? It's something scientists, ethicists, philosophers, they're all wrestling with right now. As BCIs become, more powerful and integrated into our lives, we're going to have to face some pretty profound questions about what it even means to be human.
Yeah, I can imagine. I mean, we've talked about the potential for BCIs to boost our abilities, even change how we communicate. But are there downsides, like unintended consequences we haven't even thought of yet?
Definitely possible. Any technology this powerful, there are risks, right?
Sure.
For example, some experts are worried about BCIs, making existing inequalities even worse.
Oh, how so? Well, if only rich people can afford this tech, you could see a gap emerging between, the enhanced and the unenhanced.
Wow, that's a scary thought. Like something out of a dystopian movie. We'd have to be really careful about how this tech is developed and who has access to it. What about the potential for misuse? Like, could BCIs be used to control people's minds or manipulate them?
It's a valid concern, for sure, and something researchers are very aware of. Like any technology, BCIs could be used for good or bad. It'll be crucial to have, ethical guidelines, regulations to prevent that kind of misuse.
So we need to be thinking about the ethical side of BCIs now, before it's too late. We need to talk about the risks, the benefits, everything.
Absolutely. We need to bring everyone to the table, the public, policymakers, ethicists, make sure BCI development is guided by, responsible principles.
Well, this has been an amazing journey into the world of BCIs. We've covered so much, from those early mind-reading experiments in the 70s all the way to the crazy possibilities of the future.
It has been fascinating, and I hope it's got you thinking about what's possible with this incredible technology. We're really entering a whole new era of human-machine interaction. It'll be exciting to see where it goes from here.
And maybe a little bit terrifying, to be honest.
Yeah.
But I think you're right. It's up to us to shape the future of BCIs and make sure they're used for good. Thanks so much for joining us today. It's been a real eye-opener.
It was my pleasure. Thanks for having me.
And that's a wrap on our look at brain-computer interfaces. Thanks for listening, and until next time, keep those synapses firing.